Hi everyone, I'm Mark Gullius and welcome to 30 Minutes to Better Health. We're currently joined by Rita and Dr. Ron Martin, podiatrist at the Shelby Foot and Ankle,
Yes.
correct, at the beautiful Shelby Macomb Medical Mall at 23 in Shaner. And Dr. Martin, for the patient or the people at home, obviously you're a podiatrist, and just give a brief overview how long you've been in practice, and then we'll get into your topic of the day, which would be neuropathy.
Sure. After graduating residency here locally at near here anyway at Warren in 2005, I partnered up with Dr. Giordano and opened a practice here at the medical mall.
At 23 in Shaner.
Yes.
And you've been open approximately a month or two.
A couple months now.
And it's beautiful. And let's jump right in. You know, there's always time factors. So let's get right into your specialty, one of your specialties, one of your passions, if you will, diabetic neuropathy and how it relates to the foot.
Sure, sure. Diabetes affects a lot of people in the United States and the world, but where we come in as a podiatrist, obviously with the foot and ankle, is that one of the common problems with diabetes is you can have a condition that causes numbness, and with that numbness you can get cuts, sores, which may lead to ulcers, infections without you even knowing it. And it's very important to be a couple steps ahead of that to prevent that, because that may ultimately lead to amputations.
And what does that entail? Let's say you don't want to scare anybody, but
Right.
Let's say you do a little amputation. It doesn't necessarily always end there. If they don't manage, if they don't follow your directions, and diabetes is a tough, multifaceted problem. It can get you a lot of different ways.
It is. I mean, diabetes can be a devastating disease if not managed properly. As you had mentioned, it's more of an education for diabetes and prevention. Again, and we stress that prevention in podiatry. Again, to prevent ultimately things such as infections, amputations, and so forth. There are many things that we can do well in advance to prevent those conditions, such as diabetic shoes, and just routine foot inspections. Sometimes foot deformities can cause problems that lead to these things I talked about, ulcers and so forth. And surgery may play a part in keeping that corrected and maintained. Again, all in the name of prevention.
Let's say, unfortunately, a patient, it's too late and they already have the condition. Let's talk about some of the management issues, some of the active treatments, if you will, that, let's say a podiatrist, your specialty, would employ.
Yeah, sure. For instance, if a patient comes in with already an advanced ulcer and infection, we want to move swiftly and treat that sore infection, which may even get into the bone. And we want to treat that wound, treat the infection appropriately, bring in a team, a multidisciplinary team to treat that wound and infection, which will, being such as their primary care physician, infectious disease, vascular doctors if they have a circulatory problem. And sometimes, again, we may have to bring that patient to surgery to effectively manage, control, and heal that wound and/or infection.
Can we show on Rita, some of the, let's say, basic overview? Podiatry it's a small area relatively, but it's almost an unlimited area of problems that can occur.
Sure.
So, we have a live monitor. Thanks, Rita, for showing up here on a busy morning. And let's just do a general overview of some of the things you would look at, whether it be diabetes, Charcot, you had mentioned.
Sure, sure. Diabetic patients should be seeing their podiatrist at least on an annual basis if they're not having any particular problems, again, for just a routine screening. But when the patient comes in, routinely we will check their circulation, their pulses, especially check their skin for any cuts, scrapes, sores, any calluses. These are simple things that can ultimately and quickly lead to major problems. Just a basic callus can rapidly, within hours, progress to a blister, an ulcer, and infection. And some of those aggressive infections, unfortunately nowadays, that you hear on the news with antibiotic resistance and so forth, rapidly multiply and cause harm to not only the foot but the patient as well within hours. So it's very important to again have it screened, properly managed. We can recommend again protective shoes and custom insoles to again all in to prevent blisters, sores, scrapes, and cuts, and so forth. And we also do a wide array of education to the patient to do daily inspection of their feet, to keep good hygiene, and most importantly, not to treat or self-treat any cuts or scrapes or wounds, and have us take a look at it and manage it with them.
I know I talked to your partner, Dr. Giordano, and diabetes is such a hot topic, if you will. Obviously, there's a lot of issues. It's not just a problem; it's a big problem. That there are plans for an actual diabetes day here that you all are, I think, are directing, if not directing,
yes,
quite involved with. Can you talk a little bit about that?
Yeah. What's nice about the medical mall here is we have an actual community room where we have events and plans for educating the public. For instance, we have a diabetes day coming up where we will talk about diabetes. We'll have podiatry, family physicians, dietitians, etc., to talk about the disease of diabetes, its management, and again, prevention.
A phone number, possibly if somebody at home would be interested in that, maybe get some information about that event. What's your phone number here at the Shelby?
Phone number here is 586-580-3728. You can also check our website for the medical mall, shelbymedicalmall.com, for again upcoming community events such as the Diabetes Day.
Okay, in preparation for the program, you had mentioned Charcot. Let's, we only have a few minutes.
Sure.
A brief overview of what that is, and maybe show us on Rita.
Sure. Charcot is a devastating problem that can occur with diabetes, and what it basically is a breakdown of the foot and collapse of that foot in the joints and the bones. That can rapidly lead to ulcers, infections, and bone infection, and so forth. Very common for a person that sustained a Charcot deformity is more apt to have amputations. I was blessed in getting training in Charcot reconstruction. In fact, I had a patient recently, a young 28-year-old girl that sustained bilateral, both feet Charcot problems, and was hospitalized and was given the recommendation for an amputation of her leg. They consulted me. I was able to come in, evaluate her, and do a 5-hour reconstruction on her. And today, as we are talking, she's walking with her own feet and legs without prosthetics.
Oh, that's fantastic. And Rita, we let doctors Giordano and Martin, it's always nice to have an actual patient or something. And, they have a large practice, could pick anybody. They picked you. Okay, and let's talk about maybe something, if you were, this isn't obviously a visit for you or anything, but do you have any questions for Dr. Martin, something, or tell the people home maybe a little bit about your story?
I've been blessed to have met both Dr. Martin and Giordano. I have had multiple issues with my feet, from plantar fasciitis and Charcot to constant blisters and sores, which I recommend getting your feet checked by a podiatrist 1 to 2 months continuously throughout the year. It's very important with diabetes to daily check your blood sugar, morning and evening for sure, twice a day, if not throughout the day, making sure that you are checking your feet for cuts and scrapes, because as Dr. Martin has stated, a cut or scrape can turn into a serious bed sore that could lead you hospitalized, infection, and furthermore amputation. So very important.
Dr. Martin and Dr. Giordano's off camera. It sounds like a patient of yours. Almost sound like I was talking to you. So obviously the education is paramount, which you had mentioned, and it sounds like, at least in Rita's case, she did practice what you preached, if you will. That was sounded like I was talking to him, actually.
We really stress education toward diabetic patients, and
well, it's their body, not yours.
Right.
So
and we do that every time they come in to see us.